TR, a 28-year-old male with a history of asthma, came to the ER by wheelchair, accompanied by relatives, with the chief complaint of acute shortness of breath, chest tightness, and has audible wheezing. The patient is in visible respiratory distress and has been taking his prescribed medications of Ventolin inhaler and Cromolyn sodium at home, but has had no relief of his symptoms. During a physical examination, nasal flaring, a heart rate of 120 beats per minute, a respiratory rate of 50 beats per minute, and signs of accessory muscle usage were observed. Chest auscultation revealed diminished breath sounds bilaterally, with inspiratory and expiratory wheezes. The patient coughs up small amounts of thin, clear sputum. SpO2 on room air is 80%. An ABG was ordered and the results are pH 7.50, PaCO2 27, PaO2 75. After seeing the results, he was admitted to the male medical ward by the attending physician on duty, and a medical nebulization treatment was ordered. Ventolin 1 ml and Atrovent 1 ml, along with 3 ml of normal saline.
Afternoon.
Alright, I'm Dr. Rankin. Can you remind me of your name?
Derek Robinson, Doc.
Alright, so Mr. Robinson,
Yes.
you're here today because you're having some breathing issue. How are you feeling now?
Okay,
Alright, so I'm gonna just do a test, just check your breathing. And just relax. We'll be fine. Deep breath in, deep breath out. In, out. Come again. In, out. Alright, so you're still having a little trouble, shortness of breath. So I'm gonna have the nurse come and give you some nebulizer for you to be able to breathe properly. Just gonna record it and then write it and have the nurse come and give you, okay?
Alright.
Good afternoon.
Good afternoon.
I'm student nurse Rankin Barrett. Can I have your name and date of birth, please?
Derek Robinson.
And date of birth?
31st, 1997.
Alright, can I touch you to verify, Mr. Robinson?
Yes, nurse.
Okay, Terry Robinson, 10th of the 1st, 1985. Okay. So, how are you feeling today?
I can't breathe, man.
You're not breathing properly? Okay, doctor have ordered for you to get some Ventolin, but first I'm going to check your pulse and the oxygen saturation just to see how much it is. Alright. Okay, and I just check your respiration is a bit high, it's 36 beats per minute. And your oxygen is low as well, it's at 86%. That's low. So the Ventolin will actually help to bring it up. So we'll come back with that in a while, alright? Okay, I'll be back shortly. So nurse, I'm going to be comparing the MARS and the treatment chart together to verify the patient's information. So with Mr. Tariq Robinson, he has no known allergy. He was prescribed nebulizer consisting of 1 ml Ventolin, 1 ml Atrovent, and 3 ml normal saline combined. He used to get this at 5 p.m. by inhalation, and the doctor and the pharmacist have already signed it. The treatment chart is not expired. The treatment chart was written on September 19th, 2020. And as you can see, I have found all three medications. The Ventolin for the patient, not expired, expired 2023. You have the Atrovent, which is also not expired, it expires in 2021. And the normal saline right here, which expires 2021 also. I've also have my syringe, which expired on the 9th of the 6th, 2021. And I have my needle, which expired the 10th of the 10th, 2022. Nurse, I have already done my first check. This is now my second check. So I've already found my medication for Mr. Tyreek Robinson, date of birth 9th of the 6th, 1986, and he's supposed to get nebulizer containing 1 ml Ventolin, 1 ml Atrovent, and 3 ml normal saline. So the doctor have already signed, and also the pharmacist, and I'm ready to prepare my medication. I'll be washing my hands. Okay, so I'll be pulling up my 1 milliliter of Ventolin.
Alright, so what is the reason for giving the patient Ventolin?
I'm giving the patient the nebulizer because the muscles in his airways is tightened, and by getting this it will relax the muscles and prevented his shortness of breath. Will be able to breathe much better.
Alright, very good.
And I'm also going to pull up 1 ml Atrovent. And then I'm going to pull up 3 ml normal saline. And for this, I'm going to be inserting it inside the nebulizer without touching the edge of it. Good afternoon again. My name is student nurse Rankin Barrett, and today I have with me Nurse Mackenzie. Is it okay for her to be here?
Yes.
Okay. So I have your nebulizer that the doctor have ordered for you to help with your breathing. So nurse, this is Mr. Tyreek Robinson. And it's also on here saying Mr. Tyreek Robinson needs to get 1 ml of Ventolin, 1 ml of Atrovent, and 3 ml of normal saline combined to make the nebulizer. The doctor have already signed the signature here. Also the pharmacy, the date is the 19th of the 9th, 2020, which means the prescription is still intact. And he's to get 1 dose for 2 days. But if his breathing subsides, you just need to get it once per day.
Okay.
Alright, so Mr. Robinson, this medication, since your airway is tightened, this medication is going to help to relax your airway, and it will cause your breathing to improve and prevent the shortness of breath that you're having. Are you allergic to anything? No allergy? Okay, is it okay for me to go ahead and give you this medication?
Yes,
Mr. Robinson, I'm going to administer your nebulizer now, so I'm going to place this over your mouth. Over your nose, sorry. I'm going to breathe in. So I'm going to turn this up for you. Alright, so I'm going to recheck your oxygen. And that's going to stay for about 15 minutes or so to infuse fully. And then I'll come back and check on you, okay? But if you have any side effects as this medication brings, such as nausea, vomiting, increased wheezing, increased shortness of breath, just let me know, alright? And call if you need me. I'll come back and check on you. So the 20th of the 9th, 2020, time 5:15 p.m. Patient was assessed with respiration known to be 50 beats per minute along with SpO2 86%. Received 1 ml Ventolin, 1 ml Atrovent, 3 ml normal saline through nebulization. Patient tolerated procedure. A. Rankin, student nurse, NCU. Can you sign for me, please? Thank you.
You're welcome.
Mr. Robinson, just came back to remove your nebulizer. Based on checks on your oxygen salt, I can see that your oxygen have improved. How is it breathing? It's okay now? Alright, so I can see that your SpO2 is 96%, which is very good. And the doctor will come and check on you shortly, okay? Alright.
Hi, Mr. Robinson.
Hey, Doc.
How are you feeling now?
Feeling better.
Alright, so I'm back now. Has nurse set everything and you're fine to get the nebulizer?
Yes.
Alright, so I am going to do my final assessment and see if I can release you. Let me check your respiratory. Deep breath in, out. Deep breath in, out. In for me. Oh, nice one. Alright, so you're good to go. Your breathing has been increased. You're not hearing any wheezing on the chest or anything. So I'm going to give you a Ventolin, that's a pump. See, on the prescription, this is going to be in the prescription, and some antibiotic to improve your respiratory system. So and then you can go home, avoid the night air and stuff, okay? So there you go. Be safe now.